Now, the reason the Affordable Care Act was passed is because there was a problem with our old system. The old system was the one where we let the market be free to control our health care, and they let us down. Now, I don't really know how to summarize the old system, how to summarize the details, because it really was just the private health insurance industry making it up as they went along. I never understood what I would get from my health insurance, and my guesses were often wrong. Now, I know I've mentioned it many times on this show, but I'm still angry about it that I went to get a physical in either 2005 or 2006, and my information packet said it would cost me $20 for a copay. Okay, I can afford that. I went, got my physical, and everything was fine, and then over the course of the next few months, I received dozens of bills for each individual test that wasn't covered, and it added up to over $400. I got price gouged, and there was nothing I could do about it. How many of you have an example like that running through your head right now? How many of you are thinking of someone who got sick or injured and wound up with a giant stack of bills? And how many of you know someone who didn't survive because of those bills, either financially or literally? That was the old system. That system, the freedom for the market, the private system only, that system had to go. So we had to try something else. Option number 2 is that you go the completely other way, which would be that we have a government-run public healthcare system. In this country, the common name for that is single payer. Now, I'm going to play you a clip right now from the October 7th episode of Democracy Now! They did an interview with Dr. Steffi Woolhandler. She is a professor and a primary care physician.
What does that mean when we say single payer?
Okay. Well, single payer is also known as expanded and improved Medicare for all, also known as non-profit national health insurance. It means you would get a card the day you're born and you'd keep it your entire life. It would entitle you to medical care, all needed medical care without co-payments, without deductibles. And because it's such a simple system like Social Security, there would be very low administrative expenses. We would save about $400 billion, which would allow us to afford the system. I mean, I just want to remind you that when Medicare was rolled out in 1966, it was rolled out in 6 months using index cards. So if you have a simple system, you do not have to have all this expense and all this complexity and work.
What do you mean index cards?
They didn't have computers back in 1966, okay? So they expanded, went from 0 to over 20 million people enrolled in Medicare in a period of 6 months. And because it was a simple system based on the Social Security records, it was a tax-based system. You didn't have hundreds of people programming the state of Oregon, thousands of different plans, tons of different co-payments, deductibles, and restrictions. One single payer plan, which is what we need for all Americans to give the Americans really the choice they want, which is not the choice between insurance company A or insurance company B. They want the choice of any doctor or hospital like you get with traditional Medicare.
I want that one. I want that one. It was a clear, good option. It was the simplest option with the simplest system that actually saved us a ton of money. And for those of you who have heard the spooky stories from the corporate-owned media that want you to be afraid of getting rid of our corporate-owned healthcare system, I've actually experienced the scary government healthcare system that they have over in Europe, and it was awesome. I loved it. This is how it worked. I went across the street to where the doctor's office was. Literally across the street. They had little tiny doctor's offices all over the place. So I went over there, and the reason I was there is that I had this, I don't know, weird thing that we just don't seem to get here in America where my eyes were crusted shut. It was really, really gross. And that's how we woke up every morning, and I had a sore throat, and I was a disaster area. I had to go to the doctor's. And so I go in there. The guy was super nice, spoke English, thank God. And when he said goodbye, he stood there at the counter, and I went over the counter, and I stood there, and I opened my wallet, and he said, "What are you doing?" And I said, "Well, I just want to know how much it is. I don't have a lot of cash. I only have a credit card. Do you take credit card?" And seriously, you guys, he laughed in my face, and he said, "Oh, you're not in America anymore. You don't pay here." And he sent me home. And you want to know what's even crazier? 2 days later, he called the house to see how I was doing. That's just how they do things there. And I wasn't paying into the German system. It was just, you get sick, you get treated. That's just the way it is. So that system doesn't scare me at all. And I loved it. And I would love to have that here. But here's the thing about the Democratic Party. They are supposed to be the crazy socialist liberals in this country. And in 2009, they had both houses of Congress and they had the presidency. So they really could have rammed through an awesome system like single payer. Well, you want to know why the Democrats suck and should be fired just as much as the Republicans should? The Democrats never even put that on the table. The cheapest solution, the easiest solution, the solution that the rest of the civilized world has, was never put on the table. It was not an option. Why? Well, in order for us to get the same health care as everybody else in the world, the kind of health care that doesn't take huge chunks of cash out of your pockets every time you get sick, Congress would have had to not just put rules on the private health insurance industry, they would have had to shut it down. And the Democrats are corporate, just like the Republicans, and they weren't about to do that. And we're talking about an industry that has killed thousands and thousands of Americans, literally, by limiting their access to surgeries and medicine and treatments. And this isn't just something that I've read about. It actually happened to my friend. And yesterday was the anniversary of her death. So this is personal to me. So instead of doing what was best for American individuals, the Democrats decided to do option number 3, which was a sort of compromise between the free market and those of us who need health care. What we're going to get is that the private health insurance industry, who earned the right to die, they're going to be allowed to exist, which in and of itself is a giant corporate favor. They're going to be allowed to still control our healthcare system, but from now on, they're going to have some rules. So let's look at the details of this mess of a system that they gave us that saved the private health insurance industry. So let's get started with the stuff that most of us are actually already aware of, but these are the new rules that were not in place before, but are in place now because of the Affordable Care Act. First, the insurance company can't just drop your coverage when you get sick. Also, kids can stay on their parents' insurance until their 26th birthday. Also, there will be no lifetime limits or unreasonable annual limits placed on the value of your benefits. The thing is that they can place limits on certain things that are not essential health benefits, but there is a list of essential health benefits that they have to cover, and it's actually a pretty sweet list. So here's the list. They have to cover hospitalizations. They have to cover maternity and newborn care. They have to cover mental health. They have to cover substance abuse treatment. They have to cover behavioral health treatment. They have to cover prescription drugs. And as a side note, when you hear people say that this bill was a giant giveaway to the pharmaceutical industry, that's probably what they're talking about, because all of these plans have to hook you up with your legal crack. They also have to hook you up with rehabilitation services and devices. They have to pay for your laboratory services. They have to pay for all immunizations for children and adults. They have to pay for chronic disease management. They have to pay for any approved clinical trials. So if you get cancer and you want to try something new and it's been approved by the FDA, your health insurance has to pay for it. They also have to pay for pediatric care, including dental and vision for children. They have to pay for ambulances and emergency room services. And it has to say specifically in the Affordable Care Act that coverage for emergency services cannot require prior authorization. Health insurance companies can't limit coverage because the ambulance took you to an out-of-network emergency room. And if you get treatment in that out-of-network emergency room, your health insurance has to pay for your services at the hospital. Why did they feel the need to put that in the Affordable Care Act? Because the health insurance industry was actually denying people's claims because they didn't call their health insurance company and get permission to go in an ambulance. And then they had to go to a specific emergency room or else everything wouldn't be covered. And this one actually, this part of the Affordable Care Act has already saved my family from bankruptcy. Last July, my dad had a heart attack, and we got so lucky. He had one that's called the Widowmaker, but he had already called the ambulance before he had the heart attack, so the paramedics were already standing there when he actually flatlined. He died, essentially, 5 times on the way to the hospital, which is only 1.5 miles away. The thing was, he did not clear that heart attack with his insurance company before he had it. And the closest hospital to his house was an out-of-network emergency room. Now, in the process of having that heart attack, he also had both of his shoulders broken, both of them. So when he got to that hospital, they not only had to treat him for a heart attack, they also had to replace both of his shoulders. He was in the hospital for 17 days. Had the Affordable Care Act not been passed before this happened to my family, he could have been denied for the ambulance and for all 17 days in that emergency room because he went to the wrong hospital while he was dead. That's the old system. This is the new system. Right off the bat. Don't you think this is better?